the Director of Kenya Programs and Chief of Party at the Millennium Water Alliance. And last but not least, Dr. Andrew Trimur, the Chief Administrative Secretary at the Ministry of Water, Sanitation and Irrigation. Dr. Trimur, let's come back with you. Of course, the Global Handwashing Day isn't just about response to COVID-19, but it comes rather timely in the wake of this pandemic. What impact has the Ministry of Water seen in using hand washing to fight COVID-19?
You rightly put it. This hand washing day is not just about COVID-19, it's about other diseases. Like I mentioned before, most of the other communicable diseases have actually come down. Respiratory diseases by about 23%, and diarrheal diseases by almost 45%. So it has created a lot of impact because it has been a wake-up call for us, also as a ministry, to ensure that water is actually very key in each and every area. And of course, we must now ensure that we work with our development partners, our county governments, to ensure that we have water in every area. Because when we did supply of water in Nairobi alone, we did about 5,600 hand washing points and about 6,000 tanks that we supplied. And we actually saw the impact change completely the livelihood of those people. And that's maybe part of the reason why we haven't had spikes in these vulnerable areas, areas like Kibera, Mukuru kwa Njenga, Mathare, and so on. So it has taught us that water is very, very key. And of course, alongside this is sanitation, which we must improve from the current rate which I mentioned. And so that we actually ensure that by going forward, by the year 2022 and 2030, we have actually brought sanitation to almost everywhere in the country. So it's a lesson that we have learned, and we've learned that we need to work with our development partners who are very key in this regard. And the ministry has hitherto started a Department of Sanitation, which is very key in this regard, so that sanitation has been given a priority because it's very key. We've seen it in this COVID area. We'll also see it post-COVID. So we've learned a lot of lessons.
All right. Of course, we've seen a rapid but poorly managed urbanization in Kenya lead to overcrowded and impoverished informal settlements. Like you mentioned, around 50% of Kenyans, especially in major cities, live in these impoverished areas. What is the plan to sanitize and bring sanitation to these places when, basic infrastructure, putting up basic infrastructure in these areas is a problem in itself?
Well, I agree with you that some of these crowded areas are very difficult to access sometimes, but we are working with our partners, for instance, one called Sanaji in Mukuru kwa Njenga, to ensure that we provide them with toilet facilities that are accessible, and actually they can be emptied at any point, maybe every 2-3 days, and this actually helps in these poor areas because you cannot break the buildings and access and so forth. So, and of course, water, the boreholes we've sunk is very close to them, and they can now actually draw the water so that we don't have to do a lot of piping. We only give certain water points. So it's a challenge, but it is something that we must deal with, and so that because water is very key, and of course, sanitation goes alongside with this. The areas we are now creating awareness and telling people, please do not empty your solid waste or any other liquid waste into the streams and everywhere along the where it needs to be done, so that we actually ensure that we improve sanitation in these areas and reduce the disease incidence in these areas.
Case studies can we borrow from in terms of people living in densely populated settings but have been able to ensure access to water?
Well, there are examples of cities like in South Africa, which were similar to almost our situation, but have actually been able to improve access to water and sanitation. And those are the areas we are also looking at and working with our development partners. And of course, we have a water resource agency, which is looking at also the the water resource areas, so that we ensure that we actually help these vulnerable areas, because they are at high risk. And if we don't do that, we also put to risk all the other people.
All right, Doris, let me come to you. The World Health Organization says hand washing will save lives, will spare us from COVID-19, but it's also, you know, the hand washing needs to be proper hand washing. And so in terms of, in places where there's no clean water or there's little water, so the hand washing isn't done properly, then the challenge is still posed. And so this presents a bigger challenge for those working in water and sanitation and hygiene sector. They definitely need to re-envision their strategies pretty fast. What have you been able to do in your line of work in terms of re-envisioning your strategy? Chesire from Action Aid. Clement, let's talk about response to COVID-19, even as this Global Hand Washing Day comes. But fighting COVID-19 in places where there is limited access to water has been a difficult situation. What have you been able to see in these communities?
I think there are a number of issues in the informal settlements where we are working. It's not just about access to water, but there are other basic needs which communities are actually deprived for. We saw that some of the containment measures by the government around starting from April through June. Many people lost their income opportunities. Many lost their jobs, and currently, we are speaking about a very high food insecure population in the informal settlements, and with of course very poor nutritional outcomes. And for us as Action Aid, we continue to support them through the WASH programs, rehabilitating the water infrastructure. But again, we are also looking at some of the other socioeconomic impacts of COVID. We are looking at increased violence of women and girls in the informal settlements. We are seeing a lot of destitution. So much of the programming is actually integrated. We are looking at water as on one hand, we are looking at protection from the other hand, and also looking at enhancing food security through unconditional cash transfers. We are also looking at how do we strengthen and ensure that women and girls who are impacted by some of the violence access critical response services, such as access to health, access to psychosocial support or counseling, and more importantly, of course, access to justice. So we continue supporting a number of interventions. Our response plan is an array of cuts across sectors, not just the WASH sector. We have the food security aspect, we have the protection aspect, and then of course we should also have this conversation. How do we start looking at recovery for some of the population who lost their assets, particularly because of loss of income and economic opportunities going forward. So it is a useful conversation which should be grown beyond today's Global Handwashing Day.
Dr. Twimur, Kenya, under the Sustainable Development Goal number 6, has committed itself to achieve by 2020 universal and equitable access to safe and affordable water for all, while paying special attention to the women and girls living in those vulnerable situations. Let's talk about the initiative that the Ministry of Water has had for women and girls living in vulnerable areas in terms of access to water.
Yes, the sustainable goal number 6 is actually our aim of ensuring the people get clean and safe water, and that is one of our major aims. And as we provide this water to these vulnerable areas, we realize that is the key thing. We must ensure, particularly the dry, semi-arid and dry areas, which are still way behind. And that is our target, that they get water and clean water. And of course, it will limit the girls, young girls and women going so far to fetch water, which is at high risk of not only human being attacked by being taken up by men and so on, but also the risk of wildlife, which are rampant in those areas. And of course, it reduces the conflict of human-wildlife if we provide water for the communities there, and also there's water for their livestock. So these are all the aspects that we look at as we take water to these areas.
Doris, let's talk about the fact that in several settings, there needs to be a mindset shift of what is necessary or why it is necessary to practice safe hygiene. And this provides a different challenge for those working in water, sanitation and hygiene altogether. Have you had to re-strategize on how to reach these communities?
Yes, sure. Millennium Water Alliance and our members working especially in northern part of Kenya have had to strategize a lot on reaching these communities on issues related to water, sanitation and hygiene. Number one, the cultural practices that you find in some of these communities when it comes to, for example, sanitation issues, defecating in the open. I can freely tell you, and I'm aware that most Kenyans may not be aware about this, and we take it for granted, that over 80% of these communities in these counties I'm talking about, like Orissa, like Ojia, like Turkana, are shitting in the open. What happens when they shit in the open? It rains, the water comes, collects the shit, and it goes and gets collected downstream by somebody else, and they drink it. So because there is past land and availability of somewhere to go on the open ground, people really don't construct latrines. The other cultural practices and barriers that we have, for example, the Morans don't share latrine, with their parents or with their in-laws. And so that's a fundamental issue that needs to be addressed. The second thing is that there are clan issues and marginalized communities within these settings that prohibit, investments to be done. And so for Millennium Water Alliance, having an inclusive investment, working with the counties to ensure that no one is left behind is very, very important. When it comes to sanitation issues, of course, again, you cannot separate sanitation and health. And so if you cannot link the need to have a latrine and the time that it is taken for a woman, to go and fetch water, or the time that it is taken, when looking for this water, 20 kilometers, 15 kilometers, that valuable time could be saved and invested in either caregiving practices or in productive livelihood-related, I would say, activity. And so with the Millennium Water Alliance, we are working with the private sector to bring other innovative ways of shortening the period for people, to go and fetch this water. So for example, ensuring that we are following the Sustainable Development Goal of, working with the counties and ensuring that we have people accessing water within the acceptable kilometer radius. The second point is that even when this water is available, sensitizing the communities, working with communities to ensure that they manage this water in the best way possible, such that this water is running throughout. And so what you'll find in some of these settings that we work in is that people take it for granted and they think the water is free, but actually water is finite. Water is going to finish if we don't take care of it. And so we are trying our level best to bring in private sector, like Maji Milele, to invest prepaid water meters such that each and every person pays for water. And those that cannot pay for water, the communities set up social, I would say, protection and social infrastructure to cater for this. When it comes to engaging religious leaders, for example, on why people should construct latrines, working with sheikh, for example, in the Somali community, and telling them why they need to wash hands, and then communicating to their own, Muslim communities during the mosque hours is very, very critical. And I think COVID-19 has brought a big opportunity for us.
Research from Unicef also shows that we can have proper hand washing with a limited amount of water. So let's talk about these solutions, because many times we're told when things are thick, use what you have. How can Kenyans encourage more regular hand washing with the limited resources they have, including things like rainwater harvesting, for example?
Yeah, that's a very critical question that we should all reflect about, because this COVID-19 actually, and this Unicef study, is demonstrating that this is the right time for Kenyan government, for stakeholders in the water sector to embrace innovations. You have seen Kenyans developing simple innovations like simple hand washing station that you don't have to touch, that uses very little amount of water, but also very important is reusing the water. Most of the time in Nairobi, you find people brushing their teeth when the tap is running, when somebody else in the water-scarce counties only has 20 liters to wash their hands, to cook and to do everything else. So working with the communities to see how they can conserve the little water they have is very critical. And there are innovations, working with universities actually to innovate and to look at different structures that can support using the scarce water resource that we have to cater for all the multiple uses of water that we have is important. Now, Millennium Water Alliance is working with a team of hydrologists that looks at water demand, but also look at water resource and look at how much demand do we have. You calculate the water demand, but also you look at how much available water do you have. And so allocating this water, especially in the water scarce counties, always brings conflict. You have had resource-based conflicts in the northern part of Kenya. You have had people being killed, particularly in Moyale, because people are fighting for water. So water can also bring peace, I could say. The innovations is not just a commodity, it's not just an item, but also finding innovative ways of coexistence and working in a peaceful manner with the community and sharing this critical resource. Thank you.
I'd like to go to Clement, but Dr. Twimur, let me pose the same question to you. UNICEF says it is possible to have proper hand washing with a limited amount of water. What innovations is the Ministry of Water and Sanitation exploring at this time?
Well, the issue of COVID has brought in several technologies and innovations, particularly by our young people. And as Millennium put it, it is really critical that the water that we have is really conserved. So we are used, of course, with new technologies coming in. When we provide water to these communities, we actually tell them and create awareness that this water is not unlimited. You have to really take care of it. And of course, in certain places, we've introduced water meters so that they pay for it and they actually know that something they are paying for, they must take care of that. So these are things that we are doing, particularly in the nomadic areas, which has been mentioned, because their water is very critical and it's actually a source that can bring peace to those communities. So working also with our partners, we ensure that whatever water we supply to them, we tell them the limitations and that we really need to take care so that we don't overexploit the water that we have. And that's why what I mentioned about recharging our water sources so that we have water throughout. This has been done in places like Israel where there's limited water, and actually technologies, if they have to do irrigation, for instance, with the water they have in their small gardens, then we prefer that they use drip irrigation, which uses very little water. So these are just some of the innovations that are coming into place so that we don't waste the water that we have. And as has been said before, we still have about 13% defecation in this country. And this is really polluting the water that we have. And that's why sanitation must go alongside water provision to these communities, particularly the nomadic communities.
You also earlier talked about the fact that the Ministry of Water is likely to ensure sanitation for all but the year 2025, perhaps 2030. But this, is a matter of speed. Speed is important, especially in the response against COVID-19. And well, often the Ministry of Water and the sanitation sector has worked differently or separately from the health sector. There is need now for these two activities to be considered an essential public health intervention. So once again, in terms of speed in response to COVID-19, what plans does the Ministry of Water and Sanitation have?
I mentioned before that we've created now a Directorate of Sanitation, which shows the seriousness the government has in terms of ensuring that we have sanitation for all. So sanitation is a key sector now within the Water Ministry. And of course, working with the Ministry of Health and our development partners is very key in this aspect, because we realized that sanitation had been left behind for a long time, because people talked about water, but they forgot about the sanitation effect. And so we're working with our partners and all the private sector and so on to ensure that we actually have sanitation in place by the year 2025, at least by 50% or 60%, and then by 2030 at least we have covered the entire country. It's a tall order, but it is something that can be done if we really pull resources together and work with our partners. It is something that is achievable.
All right, Clement, let me come to you, because Action Aid has been working closely with communities on the ground. In many places, there's not just access or lack of access to water, but also lack of access to soap. Hand washing needs soap and water. Talk to us about the interventions that rural communities and the urban poor are using as opposed to soap.
For Action Aid and in the places we work, what we are advancing, of course, is technologies around natural resource conservation. We are looking at advancing models which conserve water. So for rural communities, we are advancing rainwater harvesting at household level. We want to reduce service runoff. We want to ensure that communities use the best technologies, which at the end of the day conserves water. Drip irrigation, ensuring that little is wasted to evaporation. In the urban settings, we also want to see that the water infrastructure water is metered so as people pay for it, and but of course we are also aware of the fact that there are people who are living in poverty institution who also have a right to this water. So we work with communities to ensure that there is a formula which enables the vulnerable, the poor, the elderly also have access to water with affordable with monies which of course with either free or little money. But again, we also ensure that communities we are working with managing these water projects have the skills to maintain, so that we don't see the leakages, because a lot of water of course goes to waste out of leakages, out of vandalism. So the whole water resource governance is so central for us in ensuring that water is made available and the little water which is there is conserved and used optimally. So it's a balance of a number of things. So we're ensuring that the software is there, the skills for ensuring leakages are not there. Also ensuring that the infrastructure itself is sustainable.
Doris, before you take a break, there has been concern that because of the economic effects of COVID-19, water utilities could become cash-strapped if they're not able to recover their costs through tariffs, and then that would make them unable then to pay for water treatment, chemicals, and things like water quality testing as well. How big a concern is this in Kenya right now?
Such a huge concern. As you are well aware, when COVID-19 protocols were being shared at the national level, I remember this directive to all the water service providers in Kenya, the 88 utilities to provide water for free. And the directive was nobody should be forced to pay for water. But as I said, water is a social good, yes, but it's also an economic good. There is no water for free. That's not possible. Every water point, every drop of water that you find there, any cubic meter of water, it costs money to produce it. And so what USAID and other partners have done through WASH financing program is actually to support WASREP to do an analysis across all the 8 utilities to see how much they are consuming and how much they need to cater for their citizens. To surprise you, actually most of the utilities were not even able to pay for their salaries. And so what I can say is that there need to be a concerted effort. Just like our CAS was saying, the government, national government need to work with the counties to allocate enough resources to be able to cater for the running cost. The operational and maintenance cost has always been a big challenge in the water sector. And for your information, this is not only in Kenya. This is across the globe in developing countries. And so if we have to calculate how much water we need depending on life cycle cost, we have to be aware that, when you have a car, you know that after running for some kilometers, you need to replace some parts. You need to go and replace the oil filters, for example. Your tires will be worn out and you need to replace them. This should be exactly the same case with the water sector. So we cannot expect the companies, if they're not collecting any revenues, if they're not getting money from the exchequer, to be able to run the water just like that, because the chlorine will run out. The supplies will run out. These supplies need to be sustained. And so Millennium Water Alliance, we are facilitating the counties for every water point that they put to be able to calculate the life cycle costs. And actually what we have realized is that communities can plan for these well in advance. And when we tried to calculate how much money you need to save actually every month, it was less than 15 shillings to sustain a water point or a borehole that could be running for over 20 years. And so what I can say is that let's not force the utilities to provide water for free, because there is no water for free. It's just like saying you will run your car forever and you will never need a service and you will never need to replace the tires. Thank you.
All right, let's take a short break on this conversation. The work of the water, sanitation and hygiene sector is critical to halting the spread of COVID-19. Organizations, however, had little time to prepare for this pandemic. When we come back, we'll be discussing the biggest lessons learned and how the country can prepare for the next crisis. We take a break. Do stay with us. More coming up on the